Hi, welcome to BariNation, where we support the bariatric community with humor, humility, and honesty.
You've just tuned into a podcast that welcomes you into a community, a resource center, and a safe place that powers your journey towards personal wellness.
Our goal is you leave us today feeling hopeful, inspired, and ready to live your best bariatric life.
Hey friends, it's April. You're hearing in this conversation the power of community when it comes to treating the disease of obesity. And you might be wondering, why? Why do I keep hearing that I need to become a part of a community? Here's why. The disease of obesity thrives in isolation. It absolutely feeds off it, and it wants you to stay small. It wants you to stay isolated. It wants you to stay disconnected because that's where it gets its power from. As soon as you tap into a community, you start attending support groups or classes or meetups, you start talking with other people, you start sharing your story, you start leaning into curiosity and wondering what is possible for you. You are taking the power back from the disease and you're putting it where it belongs, and that's with you. When you attend a support group, when you go to classes, when you connect with others in meetups, you are literally powering your journey and you are taking away some of that control that the disease has. In BariNation, we offer supports for you if you are thinking about having surgery, if you are in the pre-op stages, or if you are post-op. We have the support, the tools, the education, and the resources that you have been looking for. All you have to do is join. Join BariNation, attend any one of our live events, and power into community. You deserve it. The disease of obesity thrives in isolation. Join us and end that isolation and tap into what can be an amazing experience for you. You can learn more at barination.mn.co. I hope I see you in the nation soon. Hey BariNation, it's April. Today I had the honor of interviewing Dr. Jaisinghani. She's an amazing triple board certified internal medicine, endocrinologist, and obesity medicine specialist. She really looks at the disease from an extremely holistic perspective. One of the most important takeaways from this conversation, what you're going to hear, is that our hormones change throughout our life. And it can feel like nothing is changing, that everything is just status quo. And then all of a sudden one day, boom, I can't make any progress. I've hit a stall, right? Something isn't working anymore. It's not that it happened all of a sudden. It's that our bodies are always in a state of aging. We are always on our way to becoming something else. And oftentimes, right, all of a sudden the scale tips and things stop working. That's actually normal. That's just aging. That is human progression. It's how we address those things that are going on in our life that can have a positive impact on how we treat our disease. It's not necessarily always the disease that's getting in our way. It's these other things going on in our life. So that is really what this conversation is about. She also really wants us to take the time to understand that we need to use space and grace along this journey, and that taking a moment to be proud of all of the things that we have actually done, all of the shifts, all of the changes, the big and the small, taking time to be proud of just us for making the conscious decision to treat this disease as a disease is how we can lift the shame and the stigma and maybe the burden that the disease has been playing in our life. It's an amazing conversation. I can't wait for you to meet her. And just know, being proud is actually a tool that we can use. And if you're listening and you're watching this podcast, I hope you're proud of yourself for taking the time for you and to learn a little bit more about this disease and about the human experience. So thank you. All right, friends, let's dive in. You're triple board certified. Let's explain to our listeners really what that means, and then what your role as an endocrinologist is and how that kind of informs how you help people with the disease of obesity.
I am triple boarded in internal medicine, endocrinology, and obesity medicine. And that means that after med school, I went to internal medicine residency And after I completed my residency, I decided I wanted to specialize and go into fellowship for endocrinology. And post that, I also took my obesity medicine boards. There are obesity medicine fellowships, and there are also board examinations that you can take at this time. So I boarded in all three. I boarded in internal medicine, endocrinology, and obesity medicine because I was very lucky to train at NewYork-Presbyterian Weill Cornell for endocrinology. And it has one of the best weight management programs in the country. So I got a lot of education about obesity medicine. So I was able to also board certify in that. So currently I have all three board certifications active, and I practice endocrinology and obesity medicine at NYU.
Insane. I mean, absolutely amazing. I have a few pieces of paper hanging on my wall, but I cannot imagine the amount of education that you've gone through. And it really sounds like as you went down one pathway, you realized that if you also kind of took in these other areas of education, you would really have a holistic picture of how the disease of obesity works and manifests in people's lives.
Yeah, absolutely, April. So, I learned even prior to entering my career as a doctor, the repercussions and ramifications of living with a disease like obesity and weight-related comorbidities like diabetes. So my grandmother actually had a heart attack in her 50s.
Oh.
And she was living with obesity and type 2 diabetes and had many weight-related comorbidities. But I learned very quickly at that time that obesity is a disease. It's not just calories in and out. It's not just move more, eat less. There are so many other factors, right? Your ethnicity, where you live, what you have access to, hormonal changes, other disease processes, right? And I lived through that experience. My grandmother ended up passing away after that massive heart attack that she had and complications of it. And it really, got me thinking from a young age, what I can do in society to help. And I wanted to help through medicine and educating people about their health. So I entered the field of medicine because of that experience that I had.
Wow.
And from there, I also knew that along with endocrinology, I really wanted to focus on metabolism and weight-related comorbidities. So that's why it was very important for me to go to a program where I could get that training and come out triple boarded.
Yes. Understandably so, because as you said, obesity is a multifactorial disease. It impacts almost every facet of our life, and a solution for one person might not be the best solution for another person. So it really does take getting to know you as an individual and then understanding how the disease is impacting your life and then treating it that way instead of just applying like a one size fits all model to people.
Yeah, I think nowadays, we're lucky that we have a growing awareness about obesity as a disease. In the medical community, it was only established about 10 years ago that obesity is a disease.
Yep. Yes. Right. With the AMA.
Yes. So that was only 10 years ago. Yeah. And even in the community now, aside from the medical community, just in the general public, we're finally starting to talk about obesity as a disease process. So I think we've had a journey, right? I think obesity was often misunderstood. I think still is today, and we're working on that. It's a work in progress, but it's definitely underdiagnosed and undertreated. And we've made progress there as well. We do have new pharmacotherapies. We do have more doctors boarding in obesity medicine. When I boarded, it was probably half the number of doctors that are boarded right now. So there's probably over 9,000 obesity medicine boarded doctors across the US and Canada. When I boarded, it was closer to probably 5,000.
Wow.
So we also have many doctors that are now interested in treating this disease process, which is really important because there's a huge need. And we also have research coming along in this arena as well because of the demand and the growing awareness.
Yes. So maybe let's take a step back. When you say that you are obesity board certified, how does that set you apart from the internal medicine part of your expertise?
Yes. So through my program at NewYork-Presbyterian Weill Cornell, in my endocrinology fellowship, they have a center which is focused on weight management. So there's a couple of pathways that you can take to become obesity board certified. You can go through a program that has a fellowship in obesity medicine. So certain centers have that and certain institutions have that, or you can take the board examination for obesity medicine if you've studied on your own through courses, books, things like that. But, not everything is just as simple as reading it. It's kind of like how we say you can read how to ride a bike, but until you do, you might not be fully aware of what that entails. It's the same thing. It's not as simple as just taking a test. You really need to understand and grasp the material and be able to treat a person as a person, right? We can learn all the guidelines, all the screening and everything, but not everybody is a textbook case, right?
Yeah. Yes.
So you need to be able to navigate that because like you mentioned, actually, obesity is not one size fits all, right?
No.
As a disease process, everyone has a different journey. You have to really take your time and step back for a second. When I see patients in the office, I have like a 4-page intake sheet where I get to learn about them, right? Where are you in your journey, right? What has your struggle been? What have your challenges been? What have your wins been? What is your goal, right? What have you tried? What have you not tried? What would you like to try, right? Where can I help? What are your other medical conditions, right? So many things that are involved that don't come from just guidelines that we read about, right?
And what a powerful question for you to hear from your doctor, right? For your doctor to say, what do you want my help with? Instead of just giving this blanket assessment, right? It's really taking the time to say, what is important to you? What's driving you crazy, right? What are you frustrated with? And then how do you see me maybe offering to help? That's a very different conversation. And I think that speaks to that obesity medicine specialization that you have. Doctors are going to approach it differently. And I think that's what's so important for us to know as patients. Seeing a doctor, that is something we have to do. But if we seek out somebody that specializes in obesity medicine, they're going to treat the disease. They're going to treat us differently because you're approaching it from a very different angle than just a regular primary care physician.
So the medical community is also, we're all humans, right? So the medical community is also influenced, unfortunately, by things from the outside, also such as weight bias and weight stigma. So because we're humans, we're also affected by that. So we need to be very aware of that. And to be honest with you, at least when I was in medical school, there was not a lot of time spent on using first-person language for this disease process, learning that obesity is a disease, how to treat it, right? And so it's a multitude of factors that physicians may be facing. One may be, yes, there may be inherent weight bias and weight stigma, and the medical community is also subject to that, right? The second thing may be is there may be some fear or frustration, right? They may not know how to treat this disease process. It's complicated, and maybe they're also overwhelmed and don't have the correct resources or the knowledge, right? So when you go through training for obesity medicine and you take an exam and you're boarded in it, there are some fundamentals and foundations which you are taught, such as using first-person language, being sensitive to the disease process itself and the person who's sitting in front of you, right? I think we forget that many individuals who come into your office seeking your help for weight management, they have probably tried to lose weight several times before they have stepped into your office doors. And it's like saying, if you applied to college 7 times, would you try the 8th time or would you give up?
Yeah.
Right. And we need to realize that weight can be quite traumatic for some people. It can be emotional. It can be stressful. And when patients come into my office and they tell me about their journeys, I see them telling me things that they probably have never shared with someone before. Right? It could be something like that they went to a weight camp when they were a kid, that they met a nutritionist when they were 9, that they used to use food as a coping mechanism when they were growing up, or that they think they potentially have an eating disorder. And I've had patients cry in front of me, probably multiple times during my clinic days, I see people who really, have an emotional reaction when they talk about this, because it is emotional and mental and physical.
Yes. There is so much guilt and shame that we carry around as patients. And until we find the right space or the right person that we feel safe and comfortable around, we're not going to disclose that information, even though it's critical in understanding us as humans and as patients. If you don't think that information is going to be received in a kind and compassionate way, you're just not going to share it. So the fact that your patients are feeling like they can share those things with you is monumental. And it's a release as a patient to finally be able to say these things, these scary things out loud, to just get them out and into the open. But man, it takes a lot. It takes a lot of courage to get there.
It absolutely does. I really think for each of my patients who even sign up for an appointment,
yes,
being a weight management specialist, you've already done a lot of thinking, internalizing, accepting, acknowledging. I think there's so many steps just right there. It's a huge feat when somebody comes to my office, and I've realized to really respect that, right? Because so many of us think that it's a failure when you're signing up to get help, right? And I would say otherwise. In medical training, if we didn't ask for help when we didn't know what to do, we would have a big problem.
Yes,
right?
we would.
Yes. So everyone is taught, if in medical training, like if we don't know what to do and there's something wrong with a patient crashing in the hospital, you hit that button on the wall for a rapid response, right?
Yeah.
And I think that's very similar in real life. When you need help, you should ask for it. And many of us feel shame and guilt and failure regarding that. And so I know when my patients have even booked an appointment and they've come to their appointment, that they've thought about it, they have good insight, they're asking for help. So you need to be aware of that when you're treating somebody, that they're asking you for help. So the first question you should sit down and ask is, how can I help you? Because they're there for help.
Yeah. Yes. It's such a powerful shift. And I don't know how or why we get away from that as adults. I think about my 5-year-old nephew right now. His curiosity is unmatched. He is constantly asking for help. He wants to learn, right? He wants to just understand the world around him. And he is never afraid to ask for help. But as we grow older, we just grow out of that. And all of a sudden it becomes a bad thing to need to want to ask for help. It's like this, individual nature of, I don't know, our culture, our country. I don't know what it is, but man, it absolutely takes hold. And we shut down because we think that we should be doing this on our own. But it's ludicrous to think that you're battling a disease. The disease is not you. You did not choose into this. And there are so many facets of it that really are out of our control. And yet, if we just step back and take the time to think about what parts of this disease are within my control, focus on there and acknowledge, I don't know how to do this. That's not a bad thing. That's actually a good thing, because now you finally have a pathway forward instead of just sitting back and saying, oh my gosh, I have no control over this and I'm going to live like this forever. No, there are plenty of things that are within our control as patients that we really can focus on, levers that we can pull. And we should ask for help. We've never treated it as a disease before. Everything's new.
Right. And sometimes it's even just curiosity, like you said, education, right? I truly think if I wasn't a doctor, I would have been a teacher. And I think part of my job as being a doctor is also to teach, right? And that's what I really love about my job, is to pass on my knowledge and to empower patients.
Yeah.
And I really spend a lot of my time in visits going through things and explaining things, because I truly think that it's what you said. It's not someone's fault. Nobody asked for a disease. Nobody asked for medication. Nobody asked for surgery. It's not like, which one would you like to pick, right? Nobody's asking for a disease. So it's not someone's fault. This is physiology and pathophysiology and biology, right? In reality, this is not fault. So I think we need to shift from that and really focus on more of a solution-based approach, right? So, and that solution-based approach has to be very personalized to the individual. It has to be specific to the person who's sitting in front of you.
Yeah. And think one of the other things that can get in our way is that if we get to this point where we realize, okay, I want help, I'm ready to pursue it, that thought of individualized attention on me can sometimes seem like selfish, like, oh, well, I'm not that special, or I don't need this individualized, I should just be able to do the same thing that everybody else is doing. But again, that's not going to serve you, because how the disease manifests in my life is going to be different than your life, because we are very, very, very different people. So this individualized approach to treatment is, I want to say, the future of medicine, but it's available for you today. And there's no reason to feel guilty or, judgmental about wanting individualized treatment. That's how you're going to really move forward.
Yeah, absolutely. And I think part of that is also, like we were talking about, going to a provider who's equipped with that training.
Yes.
Right? Equipped with that knowledge. So I would always encourage patients, once they've decided that they would like to seek care for weight management or endocrine conditions or whichever thing it is in their life, any health process, make sure you look into, your providers that you're choosing. Where are they trained? What board certifications do they have? Right? Yeah. What research have they done? Right? What are they active in whether it's in academia or outside of academia, right? Because that'll give you good insight into the provider and the skills that they have to offer.
Mm-hmm.
And I think it's really important, because you're waiting so long for some of these appointments. Sometimes you want to make sure you're going to the right place, at the right time, and sometimes it can also just be asking the provider, obesity medicine being relatively younger in the spectrum of, board certifications also, people still may not have that real hands-on training that they might need, even if they're not board certified, and some may, even if they're not board certified. So it's really about also having that dialogue with your physician. Do you feel comfortable with, treating obesity as a disease? Do you have the tools and the knowledge to do that? You can just ask them, what's your experience like with treating obesity? And they'll tell you, the physicians can be quite honest and tell you, hey, I have a colleague who's a specialist. Let me send you there. Or I think I can take care of this. Let me start the process and maybe then send you there. Or let me start the process and continue treatment with you, So sometimes just opening up the conversation and asking a physician, how comfortable do you feel with this topic, will be very telling.
Yes. We talk about this often. We are allowed to try on our providers like we try on a pair of Levi's. They got to fit. They got to fit. And that's how we do it.
I'm actually someone who is very open to telling people, even if they want a second opinion, right? I'm like, you should. I don't take any offense to it. I actually think it's better that you have multiple opinions for something for you to fully understand your options, right? And I think that's okay. If someone wants to get a second opinion or change providers, they should, because you should be happy with your care, right? You should absolutely be happy with your care. So, and it's so important. It's your health, right?
Is.
And that's the most important thing. So you need to find a doctor who understands you, understands what your goals are, and is equipped to treat your health conditions, but also just to optimize your health, right? Keep you healthy, rather, I should say, right? That they're equipped to keep you healthy.
Awesome. Let's switch gears here a little bit.
Sure.
We had a question, maybe a question isn't the right word. We have a member of our community, and they are really struggling with their return of hunger. They're feeling like a failure. They're feeling that it is overwhelming their life again, and they just don't know what to do. Medication is not an option, but they're just feeling like a failure, for lack of a better words, which I know you hear all the time. The disease of obesity absolutely involves our hormones, right? And hunger and hormones and obesity go hand in hand. What are the connections between our hormones and obesity, and how can people maybe just get a better understanding of the connectedness of them?
So the body is a very regulated system, and hormones play a big role in that, and they're constantly changing. And I think that's also something that we need to remember throughout our life. our hormones may also change. For example, right? I get females who are perimenopausal and menopausal who are coming to the office, and sometimes they may not even realize, in their early 30s or mid 30s that these symptoms are starting, right?
Yeah.
And we have a lot of fluctuations in estrogen and progesterone that may lead to cognitive changes, behavioral changes, your mood changes, menstrual cycle changes, hot flashes, vaginal dryness, such a wide array of changes, So at that time for perimenopause and menopause, these transitions, they're not only transition points for your physical health. There's social transition points, at that age and time in your life, you might have other responsibilities, your family, maybe caretaking responsibilities, career changes, right? So this is a time for a lot of change. Your hormones may be changing. Your life may have a lot of changes at that time. There may be a lot of stress, but also at this time, it's a time where you have a lot of metabolic conditions that tend to unravel, right? Because the estrogen and progesterone shifts, you may have some unraveling of or development of insulin resistance, what we call dysglycemia, right? Abnormal sugar levels, whether that's prediabetes, diabetes, weight changes, right? Metabolic conditions can really come up at this time. And it's really important to pay attention to your body composition because you can start having lean muscle mass loss as early as after age 30, which can change your body composition as well. There are so many other hormones, even aside from stage of life, that can play into weight management, right? So you have things like, for example, we talked about dysglycemia, so prediabetes and diabetes, insulin resistance, related to weight and overweight. So it can be a consequence or a driver. And you have some other hormones too, like the thyroid. You have cortisol. There are so many hormones that we have to look into when we're really treating weight as a disease.
Yeah. Yes. And this light bulb kind of went off in my head as you were talking. After we undergo bariatric surgery, right? Rapid weight loss, everything seems to be going great. And then we hit this wall, right? Where it's just like things stop working as well as they should. And I'm putting this in air quotes. But it's almost always coupled with something else going on in your life, right? It can be a job change, a death of a family member, the welcoming of a new child or a pet, right? Like there are so many things that are constantly happening in our life. But the thing that we want to blame on our world feeling like it's falling apart or like everything is in chaos is our weight. But really, it might not be. All of these other things could be going on in our life. And that's what's throwing things into chaos and disarray. But because we're so used to just blaming ourselves, I can't do this, I'm never going to figure this out, right? That just feels more comfortable. But really, it could be these other things that are throwing it off. And that can impact our hormones. And then that impacts our weight loss and the things that we're experiencing on a metabolic level.
Yeah, it's all interrelated, right? And that's why I'm saying even for 30s, 40s, early into midlife, right?
Yeah.
After 30 is really when we start seeing a lot of shifts. And that's why I was mentioning it's not just a time it's really a time that's quite complex because you're having biological changes also. You're having other pivotal moments in your life at that time. Everything is interrelated. Your emotional, physical, mental health and life, right?
Yes.
Interrelated and everything happening at the same time. So I see a lot of people struggling with that, right? I see some patients that are coming in, and as a person who's a career woman myself, I see younger females who are coming in who are also struggling with, for example, fertility, right? They have met a crossroad in their career where their career has been taking a high, but they also want to build their family. And oftentimes those are going against each other, right?
Yes.
So again, hormones, right? You're trying to balance your career with fertility, right? At the same time, we also see shifts where people may have other caretaking, obligations, whether it's children, their parents. You're also at a cross section at that time where both are important. But what people forget is you're important, right?
Yeah.
You are most important. So when I have patients coming in, I have literally sat down with some of my patients who are parents, and I've sat down with them and I've said, okay, who is going to watch your child for 5 minutes while they're showering so you can go do 5 minutes of exercise, right? And sometimes it comes down to that, right? Actually going through someone's schedule or recentering somebody who comes in who says, my mother is very sick right now, right? And it's been very stressful, and we've been dealing with rehab choices and family and obligations, and I'm not really taking care of myself because it's been too busy.
Mm-hmm.
And to recenter and say, hey, if you're not taking care of yourself, you're not going to be able to take care of everyone else.
Yes.
So let's take one step back and let's make some really simple goals. And we call them SMART goals, actually, because they're small and they're attainable and they're realistic and they're within a certain time frame. So they're very specific. But again, everything should be tailored to someone individually.
Yes.
Right. And what I mean by that is, for example, a lot of times it gets thrown around that everyone should be walking 10,000 steps a day. Well, I have people who come into my office who may not know even how many steps that they're walking every day. So then we go to their phone, we find the health app, right? We open it up. Most of the time we're registering and, seeing what's accept, not, decline, all of this stuff. We finally get there. Oh my gosh, Dr. J, I didn't even know that this was on my phone. Right. Yeah. Or, oh my gosh, I didn't know I could go back and see my weekly step average.
Yeah. Yeah.
And we see where an individual is. Maybe they were walking 2,500 steps. I'm not going to tell that individual to start walking 10,000 steps.
Yeah. That's a big leap.
That's a big leap, right?
Yeah.
But sometimes that happens where people may just be told, you have to be doing 150 minutes of exercise and walking 10,000 steps and drinking 8 glasses of water.
Yeah.
And you may say, I can't do that, right? Yeah. And you may say, okay, then forget it. I'm not even going to try because it just doesn't seem attainable. So it's really important to make small individualized goals. So I may sit down with somebody and really go through what we call a lifestyle prescription, right? And instead of it being a medication prescription, this is a lifestyle prescription. Let's talk about your water intake, right? Let's talk about how many steps you're walking. Let's talk about where you are with exercise, right? What is considered exercise for you, right? So I might tell somebody, okay, we're going to go from 2,500 steps to 3,500 steps. I might tell somebody, or someone may tell me, I'm really intimidated about weights, right? I've never picked up a weight in my life, and that's okay. You can start with 2 water bottles if you want it. I've told patients that, right? It's more about just getting comfortable first to form the idea. Yeah. And then you can take some steps up, right? Yep. But we need to be comfortable with the uncomfortable, right? You need to be okay with entering the unknown with some small regulated steps, right? That are achievable also. So you feel good that you're able to achieve them, but they're small stepping stones to your larger goal.
Yes. I think often as patients, especially patients who've chosen to onboard surgery, we are looking for a solution that is based in medicine as we traditionally think of it, right? As a pill or these new anti-obesity medicate, right? Like there should be something that my doctor can give me that will help me with this. But oftentimes the things that are most effective and are within our control are these things that everybody kind of lumps into lifestyle. But it is these little things. It's the water, it's the vitamins, it's the moving a little bit more than what you currently do. It is within your grasp and your control. But if you're telling yourself up here, well, I can never do that, or that's just too much, or I'm already overwhelmed, correct. You're not going to do it then, but you're going to continue to just spin your wheels because what will be most helpful is actually right here accessible to you in this moment. You don't have to wait months, right? Or you can do it. You can do it yourself right now.
Right. You can make a goal for every week, every 2 weeks, and it can be fun. And it doesn't have to be so stressful, right?
Yeah.
It can be very relaxed. You can do it with friends. I talk to patients a lot about changing what we think of, our classic social outings, right? Or what we do for fun, right?
Yes.
And most of the time it's going out for drinks, going out for dinner, right? Or something like that. But, how often are we going to take a boxing class together or, and doing paint and sip, something else, right? That's canoeing or rock climbing or whatever it is, right? Or whatever is physically possible for you. Maybe that's not. Maybe it can be something else, taking a walk in Central Park, right? So it can be something very simple, but something that's different.
somebody, this is like music to my ears. Somebody the other day in BariNation posted in our social feed, they had said, hey, kids are out of the house. We're doing an adults only, Easter celebration, but I don't want it to be necessarily 100% food based, right? Like, what are some suggestions? What can we do that's fun and not related to food? And it was a waterfall of fun and creative and just cool things to do that is not necessarily grounded in food or eating. And it's not to say that this isn't going to be part of it at all, but it's us taking a step back and going, well, what else could we do? Or, how could we swap this? And the ideas from the community were just awesome and inspiring. And that's part of the work of weight loss surgery, is learning to kind of reprogram what we do up here for fun and how we socialize with people, because there's so much more to life than just getting together for dinner and drinks. It's almost endless. Yeah.
I think, of course, there's a place for that, right? And there can be bonding over food, but there can be bonding over so many other things, right? But I think the most important thing you said was community, right?
Yes.
So important, right? Having that friend or that colleague or somebody to turn to, ask questions, discuss things, but also just have fun, right?
Yes. Right.
Just have fun, right?
Yes.
Sometimes we just need a little bit of a break, and that's okay.
Yes.
Right? There's so many ways to integrate small little breaks into things. Like I tell people, we're sitting down when we're on the phone and talking. So when I started doing personalies, I would go on kind of wellness walks, right? I would just call a friend and go on a walk, and I would walk and talk, right? And I think that's something simple and it's nice. I used to pick a random place that I wanted to go see or check out, and I would be, walking along the way, observing my surroundings and talking to a friend.
That's awesome.
I actually discovered that during COVID a lot. And that was my thing to do, right? Because we weren't really that social. So I said, I have to call my friends and my colleagues and family and check up on everyone and see how everyone's doing. And, I decided that was something that I was going to start doing. So I would pick somewhere I wanted to walk to. And obviously the city was shut down. Nobody was out really. And, while maintaining safety and distance and everything, I would call a friend, pop on my headphones and walk. Right. And it becomes quite once you are comfortable with some of those things, it becomes something that's part of your routine. Right.
Yeah. Yes.
So you can see that being a de-stressor after work, also sometimes before work, right? On the weekend, whatever. Right. And things change, right? You may tell a friend, like, hey, let's go on a walk.
Yes.
Right?
Yes. We talk about this again often in the community, and I've found myself doing very much what you're doing. I lead some things in BariNation, and then I also attend the support groups as a patient. And 9 times out of 10, I'm doing so from my treadmill or from my bike, because it's an opportunity for me to get some extra movement in, still do the things that I want to do, but also it just keeps me connected to my goal of becoming a person who moves more often than not. And obesity is such an isolating disease. It just is. It wants to keep us small. It wants to keep us isolated. It wants to keep us alone. It wants to keep us living in fear and shame. And the thing that we can do to break through that isolation is join a community, is put ourselves out there and just connect with others in any way that you can connect. Logging into a BariNation Zoom session, a support group, and just listening is connecting. You're hearing other people, you're hearing their stories, your brain is firing and making these comparisons between what they're saying and what your life is. That's the beginning of forming these connections that are so critically important as we continue to treat this disease of obesity. It's isolating, and we have to fight back against that isolation.
Yeah, you can definitely feel like you're very alone, right?
Yes.
And a lot of my patients do. And a lot of it stems from, again, fear, judgment, right? So I have patients that have come and told me, I hate taking photos. I had my family member's wedding and I was not in any photos.
Yeah.
It breaks my heart, I'm like, I'm going to help you do whatever you would like to with your health. And I hope that we get to a point one day where you're taking those photos, right?
Yes. Yes.
I would love for someone to feel confident about themselves, happy about themselves, feel like themselves. I think the one thing I really see a lot is patients don't feel like themselves anymore.
No.
That's why there's that disconnect, right? You don't want to take the pictures. You may not want to go to the gym. You may not want to go to the beach, right? You may not want to go to the amusement park.
Yeah.
Whatever that is, that may be a trigger, right? Sometimes buying new clothes, right? Trying
Mhm.
on.
Mhm.
It could be a simple thing. You going out to a dinner with somebody and you bought a new outfit, or you're struggling to buy that new outfit, or, it can be so triggering for so many people.
Yeah.
A really small thing can be, very emotionally triggering. So I think it's important to keep those things in mind, at least when I'm seeing patients, I hear that very often.
Yeah.
And I feel so happy when patients start connecting with themselves again.
Yeah.
And now they feel a little bit more empowered.
Mhm.
And I have some superstar patients. I have to tell you, I have some patients that, now have developed new hobbies, or lead groups, and have, become really, influential for other people to follow along their journey, have become patient advocates even. So I really have some rockstar patients who I think have really gone through incredible journeys on their own that I've got to witness, and help along the way. And not only empowered themselves, but empowered others,
Mhm.
which is so powerful.
Yep. I wholeheartedly believe that more people will seek out treatment for obesity when they hear more stories of patients successfully doing so, right? And it's living their life out loud, living their life authentically is the path forward, I think, for other people. Because when you realize that person used to look like me, and I know what it feels like to live like me in this moment. But if somebody who looked like me and I know what they're thinking can live a life like that, then there's hope and possibility for me too. But if you're not seeing those stories, if you're not interacting with those stories, it's really hard to tap into this incredible power of hope. And you don't have to be an influencer. You don't have to have a platform or a personal brand to do it. You just living your life as authentically you is power enough, because other people are going to witness that. They're going to see that.
Absolutely.
That's how we change.
Yes. I can't tell you how many people I see in my office because their friend, their neighbor, their colleague have shared their journey with them.
Yes.
And they're like, I also want to improve some things that are going in my life or in my health. I'm also going to go and seek some help.
Mm-hmm.
I think, you can live vicariously through somebody and see their journey, right?
Mm-hmm.
On the flip side, there's also often I'll see with patients, they'll come in and they'll say, but this person that was on this Reddit forum or my girlfriend or whoever, right, is losing this much weight this quickly, right? And I was like, wait, we have to talk about this, right? You are different than that person, right? In maybe many different arenas. So we have to focus on you, right? And your improvements and your challenges and your struggles and your barriers. So I think it's good to exchange always your journeys, but also to remember at the same time that your journey may be very different from somebody else's because of many different factors, right?
Yes.
So, and that's okay. And that's totally fine.
Yes. And it kind of reminds me of what we were really just talking about. Your hormones, your body, you're always aging. So while we can go through these periods of our life where we feel like everything is staying the same, I think it's a really important check for us to just acknowledge everything is not staying the same. Everything is always aging. Everything is always changing. It just might be that the change is so minute, you don't necessarily notice it. But when you're hitting that stall, when you're hitting that wall, right, when it feels like you've just come to a place that you can't make progress in, that could be a moment to really step back and go, I was always changing. I was always getting to this point, but now it's kind of crossed this threshold to this point where I need to do something different because the change has been great enough to not keep working with the things that I was doing.
Yeah. So this happens every day, right? I have patients come in and say, I know exactly how to lose weight. I've done it many times and it's not working anymore. That could very well be happening. That is correct, right? Because like you said, things are ever changing. And sometimes we may not notice the small changes. When you're 20, we all think we're invincible, right? We're invincible. We're in our 20s, right? But I often have people coming in their 30s and they don't realize, right, that lean muscle mass loss started.
Yeah.
Nobody's talked to them in their mid-20s about doing the strength and resistance training to help prep for that loss that you're going to have. How much protein they're supposed to eat, why that sleep is so important, right? Not just the quantity, but the quality of it, right?
Yes.
So there's so many conversations I think that are not had early enough because people don't realize, right?
Yeah.
That at 30, so many changes start happening.
Yes.
Right?
So many. Oh my gosh. I can. Yes. Yeah. Not just women. Everybody goes through these aging process. Everybody's hormones change. And it's important to understand that those hormones are really driving so many of the things that are happening in your body and in your system. It's not a you thing. It's your hormones in your body are aging and things are changing. So focus on what you can focus and control on, and then work with a medical professional, hopefully somebody that's obesity board certified, right, to help you through these normal life changes.
Yeah. And I think that's something that we need to also acknowledge, that some of these changes are normal, right?
Yes.
Some of them may not be, right? And they may be difficult to encounter, right? And some of them are choices that we haven't made, right? So for example, genetics, right? If you have high cholesterol because you have a genetic marker or you have a predisposition to it, right? These are things that may not be, maybe, for example, I've had patients lose 70 pounds of weight and their cholesterol hasn't budged, right?
Oh, yeah.
Because they have a genetic predisposition, right?
Yeah.
And you do need medication therapy for that. And that's okay, right? Sometimes you need to adjust to the cards that you're dealt, right? And you do the best that you can. And that doesn't mean that you don't make the lifestyle changes that you need to, but you give everything your best shot. And if you need escalation, right, in terms of therapies, that's okay, right? It's the same way we treat weight. It's the same thing for most chronic medical conditions. We start with the basic tenets, the basic foundations of health, right? Which I think are often not talked about enough, right? Because they're actually really challenging.
So I was going to, what are they? What are those basic tenets of health?
Yeah. So, these lifestyle prescriptions that I was talking about, right? So how many times have you gone to the doctor and they've asked you how much water you're drinking during the day? How many times have doctors asked you how much you're sleeping every day? If you're sleeping well, if you sleep through the night, do you feel refreshed, right? How much are you strength training? How much protein are you getting? How much fiber are you getting? How's your stress reduction, right? So it's so easy to say, oh, don't stress, right?
Yeah.
But what does that really mean, right? So sometimes I see, it's also struggle because there are stigmas in other arenas too, right? So if I tell someone anxiety, depression, and eating habits, right? Coping mechanisms, these things are all interrelated. Maybe we should see a clinical psychologist. They may be taken aback for a point and they may say, why do I need to see a clinical psychologist, right? But I think actually mindful eating, coping mechanisms, right? These are all, again, interrelated. They're part of a comprehensive plan. If I had a perfect situation, right, where I had, let's say, my own facilities, my own practice, I would have an exercise physiologist, a nutritionist or a dietitian, a weight management specialist, probably other specialists, right? Cardiac specialist, GI specialist, right? Everyone in one arena. And clinical psychologists and psychiatrists, so important. We need behavioral modification too, right? It's not just that you're going to eat less, right? That's not what we're talking about. We're talking about when I have a stressful day and I go to my pantry and say, I'm going to have Cheetos because today sucked, right? Where is that stemming from and why is it stemming that way? Do we need a better coping mechanism for that? Yes, we're acknowledging stress. Is this a craving? Is this hunger? What is this? Is this emotional eating, stress eating, right? So we need to be able to navigate these questions, right? We need to be able to also build up defenses for these situations, right? Everyone goes through stress during the day. So what's a better outlet, right? So we need to sometimes build these mechanisms of what we should do sometimes in these situations. And again, I think it's totally okay to go and have that discussion with somebody. Sometimes it's about your relationship with food. Right? What is your relationship with food? Sometimes it's about timing of eating. When do you eat? right? Sometimes for some people, even food order may be important, right? How your body metabolizes that sugar, right? So there's so many factors around nutrition that I think can be discussed.
As a patient, I think it can feel overwhelming, right? Because you've committed to treatment and you're going down this path, and then all of a sudden you hit a wall, and then you look at what is in your control and it's like, oh my gosh, there's so much here. I'm not doing any of it. And that just overwhelms. And then it's the all or nothing thinking, right? It's like, if I can't do all of these things, then I'm not going to do any of them. That again keeps us stuck. So
Yeah.
what advice or what recommendation would you pass along to a patient that is maybe feeling that overwhelmed? They're looking at this obesity landscape. They're looking at all the things that are within our control, and they're just feeling like, I can't do it all. Where is a place for somebody like that to start?
So there's a couple of things. One is, in my practice, I see my patients every 1 to 2 months. Okay. So certain providers, if you're going to a provider who has that availability, that capability, in the beginning, you may need to see a provider much more often, right? And maybe it might take some time to learn all of these things, right? Because it is overwhelming. You might need more frequent visits to understand, one, the pathophysiology of what's going on, two, what needs to be worked on, three, to develop small treatment goals, right? And I think just focusing on 1 or 2 things at a time is okay, right?
Oh, definitely.
Too much is also going to be a problem, right?
Yes.
And don't feel overwhelmed that everything needs to be finished in one visit and everything's going to be sorted.
Yeah.
You know, I'm going to walk out and everything's going to be fixed. No, right? This is a long-term process for long-term health. We don't want short, quick fixes. We want sustainable changes that'll give you good health for long periods of time. And that might require multiple meetings, right? Multiple sessions to see somebody working on maybe multiple different comorbidities, different health problems, maybe really optimizing health from all different standpoints. Right? So that may take time. So give yourself grace. First thing, give yourself grace. Second thing, commend yourself for asking for that help, for going. Third, be kind to yourself. Make small goals, right? And fourth thing I would say is be curious, be inquisitive, and ask questions. And fifth thing would be equip yourself with knowledge. Join forums and groups if you have to. Make sure you're doing evidence-based research based off what you hear. Make sure you're going to board-certified doctors or doctors who have a lot of experience in what you're looking for. So these are the few things that I would pay attention to. And then also, be proud of yourself when you're achieving your goals. I think we forget that. You know, I love to do something with my patients when they start hitting around the 1-year mark of meeting with me. I like to go back to their first visit.
Oh, wow. Oh, that's got to be so cool.
Oh, it's amazing. I go back to their first visit, you know, the notes that I wrote and where they were with all their parameters, their blood work and their vitals and everything. And we go through it. And I always tell them, do you remember when you came to me, we were here and now we're here, right? And we go just do a small recap of that journey. And it's so wonderful because, again, sometimes as time is passing by, we don't give enough credit to ourselves, right? Because we don't remember where we started. So it's so important to look at your progress and be proud of yourself. You know, you need to be proud of yourself for the progress that you've made, no matter how big or small, right? I tell my patients, like, the achievements that they have, whether my patient has come to me and lost 10 pounds or 100 pounds, I'm proud of all of them. Right? That's not the differentiating factor, but the fact that they're there, they're committed, they're working on themselves and they're optimizing their health. That's something to be really proud of. It takes a lot of dedication. It takes a lot of time. It takes a lot of effort. So I want people to feel proud of themselves.
And I'm I took myself back to my very first appointment with my bariatric surgeon when you said that. And I was like, all right, I'm going to do this too. So if you're listening or watching, we invite you to do the same. Think back to the very first appointment you had with your bariatric surgeon if you're post-op. And if you are still contemplating surgery, that's okay. Think back to one of your doctor's appointments that you've had in the last year. The fact that you are even listening or watching this podcast means that you have leaned into curiosity. You understand that you are fighting something that is a little bit out of your control and a disease, and you want to be better. You want help. You want to improve your health. That right there, proud of that, right? Because you've taken time to listen or watch. And when I think back to the person that I was at that very first meeting with my bariatric surgeon, I was scared. I was overwhelmed. I was at the end of my rope, so to speak. And I was feeling, ashamed that I couldn't figure this weight thing out. Now I'm 5.5 years post-op, and I almost feel like I'm not scared of the disease anymore, right? I know it's a disease. I know it's there. I know it's always going to be a part of my life, but I'm not scared of it because it's been brought out into the light. I can see it for what it is. I am an active part of a community. I've tapped into that education. And I've just gotten to this place where it's like, no matter what the disease is going to throw my way, I'm going to be able to catch it and do something with it because I have a care team. I have a community. Even if I don't have the answer, which I don't expect to anymore, I know where I can go to start understanding that. And that's huge for me to be able to let go and just say, I don't know how I'm going to deal with this, but I know where to go to start.
Yeah.
That's massive.
I wasn't a part of your care team or anything, but I'm very proud of you just as a fellow human for going through that. And I'm really proud to everyone who's listening as well. It takes a lot of courage. It really does, and you gotta be proud of yourself at these moments. So I encourage everybody to do that. Please go back and think about your journey. You know, I'm sure it's been incredible. I feel incredibly blessed to partake in a lot of people's journeys and just touch their lives and be a part of helping them in a way that I can. So
what a powerful exercise for us all to do today. I know it's hard for us to feel proud of ourselves because we are the same. All of us are the same humans. It's difficult for us to tap into that. But one of our mantras in BariNation is space and grace. We have to give ourselves the space to know that this is going to take time to figure out and the grace to understand that we are all human and learning to take stock of where we have come and be proud of that is worth the practice because it's how we really let go of some of that shame and some of that blame. So thank you for giving us that exercise that we can walk through. This conversation has been amazing. Thank you for your time. If people want to connect with you, where can they do so?
Absolutely. You'll find me for medical colleagues that are interested. You'll find me on LinkedIn. For everyone else, you can find me on X, on Instagram, on multiple social media platforms.
And we'll make sure all of those are linked in the show notes. So if you're interested in connecting with Dr. J, you can just open those show notes, go down, and we'll have all of that information linked there. Again, thank you so much for your time. We appreciate you.
Thank you, April, and thank you, BariNation. And thank you to all the listeners and viewers. Very, very proud of you.
We're proud. We're proud today. Bye, friends.
That wraps up another empowering episode of the BariNation podcast. If you enjoyed today's episode, keep the conversation going by joining the BariNation membership community, where you can attend live support events, access on-demand resources, and find a caring community.
Join us at BariNation.mn.co. If you found this podcast valuable, help us produce it by becoming a $5 monthly supporter at BariNationPodcast.com.
And just remember, at the end of the day, you've got this, we've got you, and we'll see you next time. Bye, everybody.